Hi everyone. So today we'll be talking about breast cancer, and with me here I have.
Hi guys, my name is Grace.
Hi, my name is Naomi.
My name is Manny.
Okay, so these lovely ladies here are going to throw insight on what breast cancer is all about, since October is the pink month. So basically, yeah, we want our audience to know what breast cancer is all about. So, what's breast cancer like? Just give them this whole insight on what it's all about, because I think people already have this misconception and all of that.
Okay, basically, breast cancer, according to WHO, is a disease where abnormal cells in the breast grow uncontrollably, and then it causes tumors to form. And not all tumors, mind you, are cancerous. We have benign tumors and we have malignant tumors. So the malignant ones are the ones that are usually cancerous.
Oh, okay. So basically, we have malignant tumors that are cancerous, and then we could also have the ones that are
All malignant tumors are cancerous, benign
okay.
tumors are non-cancerous.
Okay. So, what are the common symptoms of breast cancer? Because we would need to know the symptoms before we can say, oh, I have breast cancer, or there is a likelihood of me having breast cancer before I see my doctor. So, what are the symptoms I need to check out for?
Okay, so there are several symptoms of breast cancer, and one of the major ones that we are aware of is the lump by the breast and the thickness of the breast tissues. But there are other symptoms like redness, discharge from the nipples, redness, scaling. There are so many other symptoms. So whenever you notice any of these, go ahead.
Okay. So, who is at risk of getting this cancer? Because I've heard that women, who are the real people that are at risk of getting this breast cancer.
Breast cancer can affect anyone, but women are more prone to it. All right,
Okay.
and there's a certain age for them also can get it. Although men can also have this breast cancer, but genetically just women, basically women that mostly have this breast cancer.
Okay. So, can men? Okay, yeah, I think you've answered that question. Can men have breast
So I'll
cancer?
buttress on that. So yes, like she said, men can actually have breast cancer, but it is known that women are the ones that basically have more of these diseases, but men can actually have these diseases, but maybe like 0.5 to 1% of men, but mostly 70% to 80% of women are the ones that have these recurring diseases.
To
Okay.
further add to the other question you asked, where who are people at risk of getting
Yes.
breast cancer? So people at risk of getting breast cancer, there are people who have had family history of breast cancer. There's
Okay.
age, there's gender, as she said, there's lifestyle factors. So all this can also be put together to
Okay, so basically, if somebody in my family has breast cancer, I am likely to get breast cancer. So I
Yes,
should try as much as possible to examine myself and okay.
right
and if you have also had like
previous
breast
breast cancer or
issues,
ovarian
yeah.
cancer.
Okay. So there's this thing that they always say we should examine our breasts. So I don't know. I want to know how I can examine my breast to know that okay, I have this thing. Oh, let me run and see the doctor. So
Okay, basically, there's what we call self breast examination, and it's really easy to do. Typically, you can do it standing in front of your mirror, you can do it in your shower, you can do it lying down. But basically, it's just the same procedure. You use the three middle fingers of yours, the pads of the three middle fingers of yours, and then you just massage your breasts. First of all, you go lightly, then medium, and then firm. Just massage, like in a circular motion would be preferable. If you massage in a circular motion all around to the nipples where your areola is, check for discharge. Also check like your underarm areas because you can also find lumps there. So that's basically how you check for breast cancers.
Okay, so when next
For 2
I
months.
want to check, I need to do the steps, right?
Very
Okay,
important.
very okay, privately, no problem. So, I heard that mammograms are what we use to detect breast cancer. So, at what age can we say women can go for this mammogram?
Okay, first of all, we need to understand what mammogram is.
Okay.
Mammogram is a low dose X-ray examination for breast tissues. So there are other examinations that someone that has a breast cancer can go through. There's MRI, there's biopsy, there's surgery, and every other one. But we're talking about mammogram. So women between the ages of 40 to 44 can actually like inquire from their doctor to know the risk and the benefit of these examinations, while women between the ages of 45 to 54 can actually like do it every year. Then women from the ages of 55 and above can do it every other year, maybe once a year or once in 2 years, and all of that. So it's going to help.
Also, basically everything that is concerning medicine always have guidelines.
Yeah.
Okay.
So most guidelines will tell you that from age 40 everybody should, like she
Yes.
said.
Yes.
Also, if people that have higher risk of getting breast cancers, remember we
cancer.
talked about age, we talked about family history, especially family history, and then previous cancers like ovarian cancer or even previous breast cancer, so they can get their mammograms at early ages like 30.
Okay.
Even
Okay.
we also talk about like radiations as well. So that's why sometimes they advise that you reduce the amount of medical examinations that has to do with that. It exposes you to those radiations.
Okay. Okay. So, I think when I'm up to like 40, that's when I'll check for breast cancer. Right
Still
now,
young, girl.
I'm still young. Can my lifestyle choices affect the risks of breast cancer? Because I've been hearing lifestyle, age, previous history. So I want to know if what kind of lifestyle I need to live that would expose me to this breast cancer or would not expose me.
Okay, while there's no specific cause of breast cancer,
Okay.
there are certain lifestyle choices that you make that can either, let me say, make or mar you. For instance, having a sedentary lifestyle will put you at risk of having breast cancer than somebody who does regular physical activities. Your food choices, eating unhealthy would obviously put you at risk of getting breast cancer than somebody that eats a balanced diet and eats healthy. Also, life choices like regular consumption of alcohol, smoking can also put you at risk of getting breast cancer.
Okay, so basically, I have to eat healthy and get in touch with my physical self. I need to be going for my exercises and all of
Right.
that. And I should stop taking alcohol. That means I shouldn't party hard.
Yes.
Okay.
Of course.
And for breastfeeding moms, I think it's advisable to breastfeed your child longer, because I also read that breastfeeding moms can actually have the chances of getting breast cancer. But the longer you breastfeed your child, you can actually avoid that.
So, mamas out there, please let that baby suck
Of
that
course.
breast for a very long period of time.
Yeah.
Okay, so I imagine myself now checking for breast cancer, and then I discover I have this lump on my breasts. Right, I have this lump. What should I do?
Basically, the first thing that you need to do is to contact your healthcare provider. Right? That's the first thing, because when you have done your examination and you're noticing that there's some strange things that you're not feeling properly, right? So first thing, call your doctor, whoever is there, or just call your medical practitioner and tell the person that look at what I'm experiencing. Then this healthcare provider can easily determine the cause, if it's your lifestyle choices, like she said, and then is it a family trait or something? Just know the cause. What are you doing that is causing all those things, or what's happening, right? And then also they would run some tests on you, some imaging tests and all, and then probably give you treatment if necessary. Yes.
Okay.
Okay. Also, I think before you go to your healthcare provider, like she mentioned, there are things that you should take note of before you go to the changes in the size of your breast, shape of your breast. And usually there's this thing called dimpling. So when there are signs of breast cancer, there is similar to the back of an orange peel. So when you put the back of an orange peel like in comparison with the breast, you see it's like this small
Yes, there's
dots.
small dots
Do you get,
here.
yes, around it. So when you notice things like those are things that you should have at your fingertips when before you know call the doctor or
Okay.
before you see the doctor, because they will ask you for, there's always a procedure before they delve into treatment. They will always ask, how did you feel? Is it associated with pain? Is it associated with discharge?
I honestly think that we should take note of that, because
And then
that's a
stay
very
calm, stay
important-
calm.
Okay,
Yes.
so I shouldn't
That's a
fret
very
when I see
important-
it.
Exactly. The first thing you should do is stay calm,
Stay calm.
before you check for
Okay.
those
Yes.
things, and then you call your health.
Okay, stay calm. Stay calm if you have that. Just stay
And
calm.
talk to someone if you have someone to actually talk to.
What if I don't have now?
You just stay calm.
Talk to
Okay.
God.
So I know that we are not really aware, and there are different types of breast cancer, because I really don't know, or I would like to know if there are different types, so that we could just get to like,
Of course, there are different types of breast cancer.
wow.
I'm not sure the number of breast cancers, but there are just a few. Have inflammatory breast cancer, which is a very rare type of cancer, but is very aggressive. So we also have HER2 positive breast cancer. We have triple negative breast cancer, and just to mention but a few.
Wow. Wow. Those are like, I think this is the first time I'm hearing this different type, because anytime I just hear breast cancer, like they don't really tell us the different types. So thank you very much for giving us this insight to the different types of breast cancer that we have. So basically, whenever people have breast cancer here, they'll just tell them cut it off. So I don't know, is that like the treatment? Are there different types of treatment for breast cancer, so that we can know, so that just in case we don't have that fear that if I have breast cancer, first thing is they're going to cut my breast off, or they're going to cut it off my hand, this kind of thing.
Okay, so talking about treatments for breast cancer, there are various types of treatments. Your healthcare provider is in the best position to name the treatment that works for you. So we have surgery, and speaking about surgery, we have lumpectomy, and then we have mastectomy. So lumpectomy is the removal of lumps from the breast, while mastectomy is the total removal of the breast. Again, your healthcare provider is in the best position to say what treatment works for you. And there's also radiation therapy. This is using high energy waves to target the cancerous cells, or cancer cells, sorry, and then kill them. There's also chemotherapy, there is targeted therapy, there's hormonal therapy, there's a lot of treatments that your healthcare provider will just... And sometimes there could be a combination of treatments depending on what your healthcare provider wants, or depending on the severity of your
Okay, of my cancer. So we are saying that, okay, if maybe I don't need to cut my breast, or maybe I could go for hormonal treatment or remove the lumps or something like that.
Right.
Okay. Thank you guys so much for coming here to educate us on breast cancer, because actually October is Breast Cancer Awareness Month, and it was really amazing having you lovely ladies on set.
Wearing pink with pride.
Thank you so much, and I hope our viewers at home, we've been able to clear the air and tell you guys what breast cancer is all about, and how you should go about these things when you notice that you have a lump. So guys, thank you all. Bye.